How much does brain surgery cost? Now, if I were to ask you that, what would you instinctively say? I'll give you a minute. All right, let's break this down. And just a forewarning, I am not a medical person, I don't work in the medical field. Um, Nothing medical related. I've just done my own research, and this is coming from the perspective of someone who has had brain surgery. So let me just put that out there. All opinions are mine. I don't represent anybody other than myself. So, when it comes to brain surgery, the price can vary tremendously. On the lower end, you're looking at probably like $50,000, and it can go up to anywhere $500,000, even more. And there's a lot of different things that go into or that factor into the price of your brain surgery. Now, I'm going to go into it a little bit and then we'll just talk quickly about how much I paid, how much my surgery cost overall, and then how much I paid out of pocket, because obviously I did not just pay for this operation. So, one thing that is going to impact the price of your or the cost of your surgery is the type of brain surgery you need to have. And I say that because I think a lot of people hear brain surgery and they think craniotomy, which is the most common, I'm pretty sure it's the most common way of having brain surgery. Basically, they saw off a piece of your skull, whichever, part of the brain they're going in. They saw off a piece, they remove it, and they access your brain like that. So that's very common. But there are other ways of doing brain surgery, which one is what I had, which is called an endonasal approach, meaning they went solely through my nose. I do know of a case where I don't know if this was actually considered brain surgery, but they went through a patient's mouth and they cut through the muscles in his. Well, they split his tongue and they split his jaw. I'm pretty sure, and then they went through the muscles of his throat to be able to get to, like, I guess the bottom of his spinal column. So it was neurosurgery, but it wasn't exactly brain surgery. So there's different ways of like getting into the head, the nose, the mouth, and then just take a piece of your skull off. So that's going to impact your price. And then also the reason why you need surgery. Now, a lot of people hear brain surgery and they automatically go to tumors, which a lot of times that's why people have brain surgery. That's why I had it. Lots of people have it, or the people who have brain surgery have it because of a tumor. But within that realm, it's also, is your tumor malignant? Is it, benign? How big is it? That's going to play another big part into kind of the overall cost. Like, what is the severity of your case? If it's a malignant tumor, if it's life threatening, all like that is probably going to increase the price. Versus if it's a benign tumor that isn't causing a ton of problems right now, but you would definitely benefit from it being removed, that might be a little bit lower in cost. And then another, I'm pretty sure, again, this is my own research. So if I'm wrong, please, if there are medical people watching this, please put in the comments where I might be wrong or a little bit off, anything like that. But another impact of the cost, I believe, is the length of time you're under anesthesia. Is this going to be a super or predicted to be a very long and lengthy surgery? Is it going to be a 2 day surgery? Because I know I've talked to my surgeons about all this type of stuff, and they've had cases where the surgery is a planned 2 day surgery. So they might work for like 7, 8 hours one day, have a midway point and stop for the day. The patient is, awake, or the patient is woken up. Woken. Is that a word? Woken? The patient is awake after surgery, spends the night in the hospital, and the next day they get put back under for phase 2 of the operation. So the length of time that your surgery is predicted to take can impact the cost of it. Also, the length of time that you will be generally in the hospital. For me, my the length of my surgery was 8 hours. It was a little bit longer than they predicted, but it was 8 hours. So that's 8 hours of anesthesia. And then I was in the ICU for 3 days. I had surgery Wednesday. I was discharged Friday. So the length of time you're in the hospital, and then I'm pretty sure if you're in ICU versus a regular room, well, you'll be in ICU. Everybody will pretty much be in ICU after the operation, but whether they move you to a regular room or not, I'm pretty sure can impact the cost of your surgery. And then I think also the hospital that you're having this operation at, some hospitals have a more prestigious reputation than others. It is what it is. I had surgery at Johns Hopkins Hospital in Baltimore, so one of the best hospitals in the country. I would argue one of the best hospitals in the world. So that can impact your price versus if you're going to a less prestigious type of hospital. Which I will say, if you are having brain surgery, please, please, as someone who has been through this process, go to the best surgeon and best hospital you can. This is not an operation where, just anybody can do it. You need to go to the best of the best. Brain, spine, cardiovascular, anything like that, dealing with the heart, brain, spine, go to the best of the best. This is not necessarily a routine operation. So keep that in mind. So, all of those things, and I'm sure there's other things that I'm not quite factoring in, but those are the things that I can that I know for sure will impact the price, will determine how much you pay. And with insurance, if your insurance works as it is supposed to work, I've talked about this on my channel before as well. Luckily, in my situation, insurance worked as it is supposed to. I I went to Hopkins. They submitted my claim to insurance, and I have United Healthcare. Just putting that out there, and they didn't fight me one time. They didn't say we need a second opinion. Oh, this is not a necessary surgery. They were just like, they looked at my labs and my diagnosis and said, we'll pay for it. So very thankful for that, because otherwise I would not have had surgery. I wouldn't have been able to afford it. So my surgery was right around $70,000. I did not have a malignant tumor, praise God. Mine was benign, so it was non-cancerous, but it was still causing me a lot of issues. And I don't know if I mentioned this earlier, but I had a tumor in my pituitary gland, so right in the front between your eyes, and it's a condition known as prolactinoma. The condition itself is not a life-threatening condition, but it does cause a wide array of issues. And one of the best ways to treat it is surgically. So I went the surgical route instead of the medication route. So again, my surgery was right around $70,000. I did spend the entire time in ICU, not because I needed to be in there, but when they were ready to move me to a regular room, when my, I guess, initial lab work looked pretty good, they didn't have a room available. So I just stayed in ICU. And again, 3 days. And I'm pretty sure that that cost covered my 5 initial post op appointments. So from November when I had surgery until April, I want to say, I had 5 post op appointments. So that price included those. Or did I have a copay? I can't remember. Maybe I should have surgery again because my memory is just not the best. Anyway, so out of pocket, I paid $430. You heard that right. I could not believe how affordable it ended up being for me. And I remember I told myself prior to surgery, look this up, call my insurance, try to get a ballpark range. Y'all hear that? I hope the mic isn't picking up. There's a fire truck outside my window, and it's like super loud to me, but I'm hoping y'all can't pick it up. Anyway, prior to surgery, I kept telling myself, call United, try to get a ballpark range of how much this is going to be. And I kept forgetting, kept forgetting. So, one of the first thoughts I had when I woke up from surgery was I was laying there, I wake up and I was like, oh shit, how much does this cost? And at that point, it was like, well, whatever it is, I'm just gonna have to figure out how to deal with it. So when I got that bill, I looked at it and I was like, $400. And I swear, I thought they were missing some zero. But I was like, let me just pay this in full before they realized their mistake. But it wasn't a mistake. My insurance just really worked how, again, it was supposed to work. So $400 for brain surgery at one of the best hospitals that you can go to is not a bad deal. Now, if you don't have insurance, or if your insurance is fighting you on the claim, I don't really know what that protocol would look like. I can't really speak to that. So if you're in that situation, uh, I'm I'm as in the dark as you, and my heart does go out to you if that is your situation, or if you know somebody who's in that, because I can't imagine needing a surgery, or wanting to get this surgery to have your life go back to normal, and you're already stressed enough about the operation itself, because the operation can be deadly. The condition is not, but the operation to correct the condition can be deadly. So I can't imagine being in that headspace, and then on top of that having the worry about cost. So yeah, I'm not sure. I know that sucks. Like, I don't know what to tell you, but I'm not sure what to do in that situation. But luckily in mine, it ended up being affordable, and I think my co-pays for my different visits were like $10. So I can't explain to you how grateful I am that this experience did not set me back financially. It's just, I express gratitude a lot for my situation and the way that I was able to handle it, how all of these kind of pieces of the puzzle just fit in perfectly and painted what ended up being a really beautiful picture. If you're going through it right now, I know it's probably very difficult to imagine this being let me rephrase that. It wasn't a beautiful process. It was not. But things worked out how they are supposed to work out, and it was transformative. And in that whole transformation, it ended up being kind of beautiful, but when you're in the thick of it, is not beautiful. So let me just say that. But yeah, brain surgery can be very expensive, and you know, if you have the insurance and it's working how it's supposed to work, it should also be an affordable thing to do if you need to do it. So, if you have any questions, or if you have a topic about this that you'd like me to cover that I haven't already covered, please leave it in the comments below.